Hello everyone. In this video, I'm going to discuss all the important medication and different cases which I saw in pediatrics department. In pediatrics, there are like three different blocks. One is ICU, OP, and wards. In ICU, we need to check vitals hourly. We need to do night duties and like completely take care of the patient. And in OP, we just need to give basic medication for basic diseases. And in wards, we need to write repeat patient. So these are the seven cases which are interesting. Like the first case is severe acute malnutrition. Baby is having severe malnutrition and she's also having hypokalemia. So we gave potassium to her. We need to give dosage according to height and weight, also age of the patient in pediatrics. And she's having stomach distension, so we inserted OG tube and removed all the extra contents so that baby can get normal saturation again. And in case 2, again same severe acute malnutrition, but this time her mother is also having iron deficiency anemia with the history of pica. And case 3 is meningoencephalitis with hematoma. Case 4 is dilated cardiomyopathy. She's also having pedal edema. And case 5 is focal seizures, so we gave sodium valproate with skeletal abnormalities. Baby is having some skeletal abnormalities, she's unable to walk. And case 6 is malingering seizures. She's just acting like she's having seizures. She want to escape from school, so it's malingering case. And case 7 is social anxiety child. That child is not speaking outside, so she's rejected by many schools as she's not speaking, only she speaks in her home. Case 8 is dengue with thrombocytopenia, and this case I saw in ICU, and that patient went till a platelet transfusion. He stayed for 3 to 4 days, but he got better. And case 9 is seizures. Case 10 is pemphigus follicularis, so we gave tobramycin. And case 11 is about intramuscular bleeds in multiple sites. Case 12 is urticaria, again derma disorder. Case 13 is thalassemia, so we gave PRBC transfusion. Case 14 is TB with cervical and inguinal lymphadenopathy. We also did Montag's test. Case 15 is acute gastroenteritis, which is common. And case 16 is typhoid. Case 17 hepatic encephalopathy. Case 18 is very interesting. It's pill swallowing. That baby, I remember, she swallowed all the drugs from her grandma unknowingly, and she went into coma. She didn't even respond to pinprick. Next, I remember she got transferred to wards, and later her BP was high for many days, and now she got discharged finally. And case 19 is fever with seizures. She's having high fever and got febrile seizures. Case 20 is asthma, and we connect neb and also sometimes oxygen. And case 21 is diabetic ketoacidosis. Actually, it's somewhat sad to look at young kids having diabetes, that is type 1 diabetes, and they go into ketoacidosis. Sometimes, like, they're not even responding. And we check GRBS for them, pre-food, post-food, and we give 8 to 7 units of insulin, mostly to pediatric age group. Another case is calotropes ingestion. It is some poisonous flower, and we did gastric lavage for the children. And case 23 is unknown bite. They don't know, they're suspecting snake bite. So we just monitored them, but they are fine at last. And case 24 is LRTI URTI. These LRTI URTI cases, they came during night. I remember they're like very severe cases. The saturation is dropping rapidly, and babies are like, they're small babies, are unable to breathe. So we connected OG tube to them, and we connected 2 liters oxygen, and finally they came back to normal. Case 25 is UTI, case 26 hereditary spherocytosis, and this baby needs I think lifelong blood transfusion because her RBCs are in spear shape, and also I observed splenomegaly in that baby. And case 27 is viral pyrexia. It's like just viral fever, and I remember viral exanthema the most. because it got transmitted to me from patient. It's like some skin condition, like some rashes. So all these cases I'll discuss treatment next in this video. So coming to treatment part, now let's discuss the general diseases and its treatment in pediatrics. So for fever, we give paracetamol, and the formula is into zero point 0.6, weight into zero point 0.6. And for cough, we give syrup salbutamol or ambroxol. And for cold, we give saline drops or syrup CPM, or if tablet, cetirizine. For abdomen pain, we give sucralfate, Pantop, and dicyclomine. For loose stools, we give Sporolac, zinc, ORS. For vomitings, we give domperidone syrup or tablet, or ondansetron tablet or ORS. So all these are like according to the child age. If child is less than 7 years, give syrup. Child is greater than 7 years, then give tablet. In antibiotics, for respiratory cases, we give amoxiclav syrup or tablet. For UTI and gastroenteritis, we give cefixime syrup or tablet again. And albendazole syrup is for like worms in stools. And we can give vitamin A if there's deficiency. If you can see this units according to age. And in vitamin D, also again same thing, less than 1 year. You can see this formulas. And syrup iron, we give prophylaxis 1 to 2 milligrams kg per day, BD or OD. If therapeutic, 3 to 6 milligrams kg per day. Now let us see some case sheets and understand the treatment. So here you can see for unknown bite, we give injection cefotaxime, injection PCM, tab PCM, and water for danger signs. So here cefotaxime is antibiotic, PCM for fever, and water for danger signs like for dehydration if baby is having. And next case sheet is acute GE with no dehydration. So here we gave IVF ringer lactate, cefotaxime again as antibiotic, PCM and zinc for stools, loose stools, ORS also for loose stools, Bacillus clausii again same for loose stools, and syrup albendazole for worms and loose stools, like worms and stools. So you can see the treatment is like same for everything. We give mostly cefotaxime and ceftriaxone as antibiotics in pediatric wards. Next cases you can see hematuria under evaluation. For this we gave IVF DNS solution, injection cefotaxime, injection PCM, pantoprazole, syrup citralca, ORS, injection amikacin, dicyclomine, vitamin K, lactulose. So cefotaxime as antibiotic, PCM for fever, pantoprazole for gastric problem, and citralca for UTI or any kidney infection, and amikacin as again antibiotic for bacterial infection, dicyclomine for abdomen pain, vitamin K for bleeding disorders, and lactulose for constipation. Next case sheet is UTI. So for UTI we give IVF half DNS. Half DNS is nothing but DNS solution with 5D, and injection cefotaxime again as antibiotic, PCM for fever, and CPM for cold, ambroxol for cough, ORS for dehydration. So next one is severe anemia under evaluation. For this we give IVF half DNS, that is same DNS plus 5D, and injection cefotaxime as antibiotic, ondansetron for vomitings, PCM for fever, ORS in 1 liter of water for dehydration. So overall if you observe, treatment for most of the cases is same. So they're like basic medication, especially in government hospitals. So cefotaxime and ceftriaxone as antibiotics, PCM for fever always, ondansetron for vomitings, and like all the basic treatment is given in pediatrics. Maintaining vitals and also like giving right fluids to like replenish all the lost fluid and electrolytes is the main thing.